to the Mama Doc Baby Doc podcast. If you haven't been listening, just so you know, I'm Rachel. I'm a pediatrician, and this is Brenda.
Hi, I'm Renda. I'm a board certified OBGYN, and I'm also Rachel's mom.
Yes, she's
So,
my mother.
Rachel, I understand we might have a special guest with us today.
We do. You know how it goes. I'll try and show with the camera if you're watching on where you can see, but he's sort of hiding, trying to nap, sort of, in his little bouncer.
So,
But we'll
apparently,
see how it
JJ
goes.
won't take a nap today.
He's refusing his nap in his crib. He's just too awake, too alert. So we'll see how it goes. So if you hear him talking, that's him talking.
That's awesome. Well, he might have something to contribute to all this. You never know.
Yeah, I mean, he also is a baby who has been
Right.
to his first newborn appointment.
Right. So he knows all about our topic today. And that is our topic today. What happens at your first newborn appointment? So he might be an expert in the field, actually.
He probably is. He probably is. Yeah, so today we're going to talk about the first newborn appointment. And it's so important. We usually want to see the baby 24 to 48 hours after you leave the hospital. Sometimes that's not possible due to weekends or holidays, but as close to 24 to 48 hours after you leave the hospital, you're going to want to schedule an appointment with your pediatrician.
Wow, that's really soon. And I personally have not been to a first newborn appointment in a really long time.
Well,
I
you've
think
been to a lot of them, just not in
but
a
your
while.
baby brother is 21 years old. So
Yeah.
So 24 to 48 hours, that's really soon. You just got home, right?
Yeah. And it can be hard, you have so much going on right after you leave the hospital, and it can be hard to think about leaving your house. You have to pack the baby up, put him in this car seat and go, and you probably didn't sleep well the night before. But it's really, really important to have your baby looked at and weighed and have the vitals checked again. So many
Yeah, I
important
know
things we
that
do.
those first few days, nobody is sleeping. Are you kidding me? I can't believe you make them leave the house that soon.
I know, we're so mean. We're so mean. But it really is so important to have your baby monitored really closely after birth. I wish we could make house calls. I think maybe some
That
people
would be
still do. That would be nice.
okay. So, what is so important that you have to do at this first appointment? I mean, like I said, it's been a while since I had to take a newborn to a pediatrician.
Yeah, there's really so much to do at that first appointment. But if I break it down for you guys, there's really 8 important things that we do. So we'll start from the top with number 1. Number 1, we weigh the baby. That's one of the very most important things we do. And your pediatrician's going to calculate the percentage that the baby lost from their birth weight, because every
Yeah,
baby.
because every baby loses weight right after birth.
Exactly. Yes. Every baby loses weight. Some of that is, from from fluid loss after birth. They lose fluid after delivery. Some of it's just that they're not eating great. But rarely do I ever see a baby not lose weight right after birth.
Right, because before they're born, they're getting all their nutrients through the placenta, the umbilical cord. And once we cut that cord, then they have to learn how to eat. And they have to get nutrition through the milk that they're drinking, right?
Exactly. Yeah. And it can be a hard transition for a lot of babies. Actually, usually we see infants lose 4 to 8% of their birth weight before they start gaining weight again after
Wow.
delivery.
Okay.
We don't really get too worried about it until they're down 10% from birth weight. So if your baby's lost more than 10% from their birth weight, at that point, your pediatrician will probably start discussing what we need to do to help that baby gain weight. If they lose too much weight, they can be at risk of low glucose, trouble catching up to appropriate weight gain. So there's a lot of issues with that.
Right. So what are you going to do if an infant's not gaining weight? What do you do?
Yeah. So usually your pediatrician will work really, really hard to get them to gain weight at home. So they will, chat with you about different ways to feed the baby and then bring you back in a day or so to reweigh the baby to see if they're gaining weight. But if they truly cannot gain weight, usually that is an admission back to the hospital, usually to a pediatric hospital, sometimes a NICU. For more scheduled and structured feeds, and possibly a medical workup for a medical cause for poor weight gain.
Oh, and what are some of the medical reasons why a baby wouldn't be able to gain weight?
Yeah, there's multiple reasons, lots of different reasons, really. But just as an example, if one is if a baby has higher metabolic needs. So if they burn more calories than a normal baby would, they need to take in more calories, right? Usually, this kind of thing is seen in a bunch of different things, but one thing it's seen in is congenital heart disease babies. So if your baby has congenital heart disease, so a hole in their heart or where their heart isn't structured normally, their body burns extra calories just
Mm.
doing regular baby things. So these babies need to take in more calories. So sometimes for this type of thing, we'll increase the calories in the formula by having you mix it differently, that type of thing. But this is just one of the examples. There's multiple, many, many different medical reasons why a baby wouldn't be gaining weight. Great. But so, always talk to your pediatrician before adding more calories to your baby's diet, because most babies are fine with regular calories. They just need to eat more.
Right. And at that first appointment, you weigh the baby, you check the percentage weight loss from birth, and
Mhm.
10% is where you get concerned. So what
Exactly.
can a family do to make sure their baby doesn't get down to that 10% so they don't go in and have you be all
Yeah.
concerned?
Yeah,
Yeah.
well, feed the baby. Feed the baby as
Okay.
much as you can. I know that's funny and we joke about it, but this is real. And if you're breastfeeding, chat with your lactation consultant about this, because breastfeeding is normally where we see the babies lose the most weight because mom's milk doesn't come in initially. And so the baby's trying to eat, but they're not really getting anything. So talk to your lactation consultant if you're concerned about this. You definitely want to be feeding your baby at least every 3 hours, day and night. If your baby's sleeping longer than 3 hours, you need to wake them up.
And
Wake
that's
them up.
for a newborn. That's for newborn, right? Um,
Yeah.
that's the one time it's okay to wake a sleeping baby is the newborn that doesn't wake up to eat.
Exactly. Yes. Every 3 hours for newborns. Your pediatrician will talk to you about when you can start spacing those feeds out more, letting your baby sleep longer. But yes, initially coming home from the hospital, every 3 hours at least. Some babies will cluster feed where they'll feed every hour or so. Some will, but some will sleep through feeds if you let
Oh.
them. So we need to make sure we're waking them up at least every 3 hours to feed them. So that's the second thing we talk about at the visit. First thing is we're weighing the baby, and the second thing we want to make sure feeding's going well. So whether you choose breastfeeding, bottle feeding with express breast milk, or bottle feeding with donated breast milk, or bottle feeding with formula, however you choose to feed the baby, we just want to do everything we can to make you be more successful.
Yeah, and I know for some moms, breastfeeding can be really stressful, especially in the
Yeah.
beginning.
Yeah,
Yeah.
yeah. It really isn't talked about a lot. Everyone just tells you, you have to breastfeed because it's the best thing for your baby. And if you don't, you're a bad mom.
Yeah.
But no one ever talks about the fact that it's really very hard work. It's a lot of work. It adds a lot of stress and a lot of time to a time period in your life that's already probably one of the most stressful times
Yeah.
in a person's
Yeah.
life. So, your pediatrician's there to help you. We don't really care how you feed your baby, whether that's breastfeeding or bottle feeding. But if you want to breastfeed, most of us are here for you and we want to help you do that as best as we can. So talk to them. They're there to help you. They're that first appointment, we really just want to make sure, feeding's going well. Um, and things that your pediatrician can do to help, they can refer you to a lactation consultant that works outpatient if you need one. Most people have one in the hospital that they talk to while they're there, but they do have outpatient appointments as well. So we can refer you to that. We can help you get a breast pump. We can help you get in touch with WIC if you qualify for WIC. They normally have lactation consultants through WIC, or you can get formula through WIC if you want to do
Right.
that. And then they can also talk to you about appropriate ways to feed your baby. Like, for example, the AAP doesn't really recommend goat's milk or mixing rice or oatmeal into the bottles anymore. Sometimes your pediatrician will recommend that for other issues, but just if your baby's normal and doing fine, we don't usually recommend that anymore.
Right.
Yeah.
So let's say the feeding really is not going well and the baby is not gaining weight. What are
Yeah.
some things that you might do?
Yeah. So one of the things that I usually recommend is called the triple feeding plan. I've heard people call it other things, just where I was trained, that's where we called it. But this is for babies who you're trying to breastfeed the baby and they're not really gaining weight right after delivery. And this is where it's triple feeding plan. So you're doing 3 things every 3 hours. 3, triple, get it? You're going to feed at the breast. And then you're going to bottle feed either express breast milk or supplemental formula. That's 2. And then you're going to pump and breast milk and save that for the next feed. Those 3 things, this is so time consuming. Normally by the time you're done doing all those things, it's time to start back over at the beginning. So it's super stressful. So just do the best you can and ask for help. Don't be afraid to ask for help. Usually when I'm talking to my patients, I give the job of bottle feeding to the dad or the non-breastfeeding partner. And so after the mom tries to breastfeed, hand the baby to dad bottle feeds while you're pumping. So that at least it's like teamwork.
Right. Yeah.
Yeah, but pumping is so important. It increases your milk supply. And, sometimes if you have a good supply, pumping can make it worse. It can make you
Yeah.
engorged.
It could cause engorgement. That's right.
So,
Yeah.
so that's different. But in the beginning, if your supply isn't coming in and the baby's losing too much weight, we really recommend pumping to increase supply.
Okay. So we check baby's weight. We make sure the feeds are going well. What else do you do at that first appointment?
Yeah, we're going to check the baby's vitals. That's the 3rd thing. And this can be so important because, like we discussed in previous episodes, a baby's vitals can give us good info about how the baby's transitioning to life. They were inside of your belly in a sack of water and they didn't have to breathe. And now they come out and they have to breathe. So that's a huge transition for them. So when we check the vitals, we're checking their transition. A low oxygen saturation can be a sign that the baby's lungs or the heart is not transitioning well. It could be a sign of congenital heart disease, like a hole in the heart even, or like a heart that's not structured properly. A fever could be a sign of infection and a really serious one, even if the baby doesn't look super sick. So
yeah, that's right. I remember you said if a newborn has a fever, they have to go to the emergency room. I remember that.
Exactly. Under 2 months, fever in a baby is an emergency, and that baby needs to be taken to the ER for what we call like a sepsis workup. Definitely under a month. Most of the times under 2 months, we're going to recommend this sepsis workup. And that's where we check the baby's blood, urine, and we usually also do a spinal tap and check the spinal fluid for infection. If you remember in our GBS sepsis episode, we talked about this. This is one of the infections that could possibly cause fever in a newborn. And they need to be checked out immediately because it could be fatal for babies.
Right. Okay. So what else? I know you also monitor the baby for jaundice and recheck the bilirubin if needed, right?
Yes, exactly. So we check jaundice when we do the the exam, make sure the baby's skin doesn't look super orange or yellow like a Oompa Loompa. And we're going to check their eyes too for scleral icterus, which is where the little white of your eye gets yellow. It can make them, yeah, like I said, look like an Oompa Loompa or like they ate a lot of carrots or something. A little carrot baby. We do a lot of things as pediatricians. We're looking at the records from the hospital. We're going to look at the bilirubin that was checked in the hospital. We're going to look at the baby's weight. We're going to talk to you about feeds and how the baby's pooping. We're going to use all that information to decide if we need to continue checking the bilirubin on the baby. Sometimes we will ask you at that first newborn appointment to recheck that number. Usually that's a heel poke. Some offices can do that in the office. Sometimes you'll have to go to a lab to get that done. Some hospitals do have the ability to check the bilirubin transcutaneously, which is over the skin. It's a little machine. They just hold on the baby's skin and it reads the bilirubin number. It's not super accurate, but it's good enough for initial. And then, if that number is a little higher, we'll recheck with the serum. But most outpatient clinics, we don't have that option. So we're just going to do another blood draw to check it.
Yeah. So tell us, what are some of the things that can make a baby higher risk to have elevated bilirubin?
Yeah, that's a great question. So bilirubin, we've talked about this previously, but bilirubin is a product of blood breakdown, right? So anything that increases the amount of blood needed that the baby needs to break down is going to increase the bilirubin. So for example, it's now standard practice to do delayed cord clamping.
Right. Right.
Yeah, and that increases the amount of blood going to the baby. All that extra blood from the placenta is running into baby. So that's going to be extra blood that needs to be broken down. Bruising from delivery is very traumatic.
It is. Yeah.
Yeah. JJ had a huge hematoma on his head.
Yes.
And so he had issues with bilirubin from that.
I remember you were really worried about that.
I was, yeah, because he looked like a Oompa Loompa. You can't say he didn't. He was a little orange baby. Even now I look back at the pictures and I'm like, oh my gosh, he was so orange. But yeah, so he had a huge hematoma, and that's extra blood. It's a blood collection right on his head from that vacuum. That's got to be broken down after delivery too. So anything that increases blood. Other things, like if mom and baby's blood aren't compatible, we'll talk about blood types in another episode. But if mom and baby's blood are not compatible, it can increase the risk of mom's blood attacking baby's blood. And that can break baby's blood down more, and that will put them at higher risk for higher bilirubin too. Because baby's going to get some of his blood genes from dad, so he can have a completely different blood type from mom.
Absolutely. Yeah.
Yeah. So mom's blood attacking baby's blood will make it break down as well. Other things, like if a sibling needed phototherapy, that can sort of put baby at higher risk for needing phototherapy as well. And then if babies are born premature, or if they have an infection, those things are also going to put them at higher risk.
Right. Now, I've also heard that babies can have jaundice from other things, not just normal blood breakdown after delivery. For example, breastfeeding. I've heard of something called breast milk jaundice. So tell us about that, and what does that mean exactly?
Yeah, yes, exactly. So babies who breastfeed are at higher risk of jaundice for many reasons. This is why if you're breastfeeding, they might ask you to stay an extra night in the hospital. One, so they can help you with breastfeeding because it's hard, but also normally they have issues with bilirubin. And so they want to check it again. This is one of the things that could keep you from getting discharged and then, needing to get admitted back to the hospital for phototherapy.
And that's like the last thing you want to do. You take your baby home. You do not want to go back to the hospital with your
Exactly.
baby.
Yeah,
Yeah.
exactly. But, if we keep you longer, sometimes we can catch if you need phototherapy, so we don't have to send you home and then bring you back. You're right. You don't want to come back. So breastfeeding jaundice versus breast milk jaundice, two different things. Let's talk about it. So breastfeeding jaundice is when the infant is breastfeeding at the breast exclusively and mom's milk doesn't come in the first few days. So baby
Right.
isn't getting that much to eat. This is kind of what we talked about before. The way babies get rid of the bilirubin in their system is by eating and pooping and
Right.
peeing.
Right.
So if you aren't getting much to eat, then you're not going to be pooping or peeing.
Right.
So the bilirubin stays in the blood, and then the baby gets more and more jaundice. So that's breastfeeding jaundice. There's just not enough milk supply to feed the baby to help them get rid of that bilirubin. Breast milk jaundice is different. It's not as well understood, but what we think it is there's a particular enzyme in mom's breast milk that she doesn't have that's needed to break down the bilirubin. So not all
Oh.
of the bilirubin gets broken down. This only happens to some babies. Over the past year, I think I've seen it 2 or 3 times. But it only happens to some babies. And what happens is they just stay jaundiced with even scleral icterus. They have yellow eyes, yellow skin for a month or more after
Oh,
delivery.
wow.
For those babies, your provider will check your bilirubin with a blood draw. And as long as it's not within light level, you just keep breastfeeding and you just monitor the color of the baby. But the baby stays yellow with yellow eyes for a while.
Oh my. So I remember that if the number of the bilirubin does get too high, you treat them with phototherapy. And it's like they're in this little tanning bed. They get little sunglasses and they're laying under the lights.
Yeah. Yeah,
And
it's
it's kind
really
of
cute.
cute.
It is cute. Yes, exactly. We can do phototherapy in the hospital. This is where we get, like you said, a little tanning bed, a bed
Yeah.
under these UV lights, and they get little eye covers to protect their
Right.
eyes.
Little sunglasses on.
Yeah, the UV light breaks down the bilirubin for the baby in their
Right.
blood, so that they
Right.
don't have to deal with it anymore. But we're in some places like where I'm practicing now, we have a Billy blanket company, so you can do phototherapy at your house, which is really
That's
nice.
so much better. So much
Yeah,
better.
it's so nice. So it's a little pad, almost like a small heating pad, and you wrap it, you put it under the baby, and then swaddle them up. So it's right next to their skin. Um, but it's really nice because you can do it at home. Normally, what we're going to want is the baby to be exposed to the light as much as possible in a 24-hour period. So you can take the baby out to change the diaper, feed the baby, but otherwise you want them under the lights as much as possible. And then after 12 to 24 hours of lights, we're going to recheck that bilirubin number to make sure it's going down. And then, I have heard of some providers, and sometimes I'll do it too, where they'll want to recheck the number again 24 hours after being off lights to make sure the number
Oh,
isn't
gotcha.
skyrocketing back up and we don't need to do
Gotcha.
lights again. Yeah.
Gotcha. Okay. So that's bilirubin. So what
Mhm.
else do you do at that first appointment?
Yeah. So, we talked about we're going to check the baby for jaundice, but we're going to do a full exam on the baby again. The baby got a full exam in the hospital, but it's been 24, 48 hours, and 2 eyes are better than 1. So we'll recheck the baby again. We're going to check that baby from head to toe, make sure there's nothing weird, nothing abnormal that needs to be looked at further. And to make sure that there's nothing about that baby that will put them at higher risk for other issues. You just got to remember this is a new human being. And it's only the second or
Yes.
third time someone has ever fully looked at this baby to make sure everything formed correctly. Their palate on top of their mouth, their eyes, their ears, their nose, their heart, their lungs, vagina, penis, arms, legs, fingers, toes. We're going to
Yeah.
make sure they have, normal neurologic reflexes too. Babies have certain reflexes that adults don't have.
Right. Right.
Some of them, like how the baby grabs your finger.
Right.
And if you put your finger on their toes on the bottom of their feet, their toes will also grab you. That's palmar and plantar grasp. They have the startle reflex, the Moro. They have reflexes.
Yes.
So we just make sure all that looks normal. That's going to give us a good idea if their brain is working normally. We're going to look at their umbilical stump and make sure it looks normal. Their circumcision, if they have one, make sure it's healing well. And, we'll look for abnormal rashes and birthmarks, all that good stuff.
Yeah, and I know that's really important. If some issues are caught early, they can be treated easily and taken care of before they have a significant impact on the baby's life. I know you also check on the mom sometimes too, and as an OB, I
Yeah.
really appreciate that.
Yeah, of course. I definitely always check on moms and dads first. That's the first thing I talk about when I meet a new family. Even though the baby's my patient, the parents are the ones that have to take care of my patient. So I have to make sure they're in a good spot, to do that too.
Right.
Um, we definitely do a postpartum depression screen. I think most pediatricians do that. Check on the mom and dad, make sure they're mentally in a good place. In a previous episode, we talked all about postpartum depression, and I
Right.
learned 1 in 10 dads and about 6 out of 10 moms have issues with
Right.
postpartum
It's
depression.
so common. Yeah.
Yeah. Yeah. So I definitely check on them. I encourage them to chat with you, their OB, or their family doctor if they are having any issues. But if they're not getting what they need or can't get a hold of somebody, let me know. So I always say. Sometimes I'll even check mom's blood pressure too. I had preeclampsia, I guess.
Yeah, you did.
So I had to have my blood pressures checked after
Yes.
delivery, even though I'm still in
Yeah.
denial about it.
I know you
I
are.
had to have
Mm.
I had to have my blood pressures checked, and I checked them in my office when I would go for JJ's appointment. So I offer this to a lot of my moms too. For a mom, this is normally the first time you're seeing a doctor since you left the hospital. It might not be a doctor trained to take care of you, but we can do a blood pressure.
Sure.
You'll see us very frequently after delivery. So if you're having headaches, swelling, feeling off, that day you just woke up and aren't feeling great, let us know. We're happy to check your blood pressure in the clinic and let you know if, hey, you should probably talk to your doctor about that.
Yeah. So, Rachel, this is really great. Okay. Because preeclampsia can be so significant and it can actually happen even after delivery. We see a
Mhm.
spike up to a week after delivery. And you're right, as an OB, I'm not seeing the mom back a week after delivery. So, I think it's really great that the pediatricians are also checking in on moms and just making sure that they're okay
Yeah.
too.
Yeah, of
Yeah.
course. Yeah, of course. But yeah, so I try, and if they had a C-section, try and ask them how their pain's going, all that good stuff, and
Sure.
encourage them. Moms were so good at like brushing off our symptoms to take care of everyone else, but encourage them.
Right.
Talk to your doctor, like get some help. Are you taking your pain medication? Hello, take your pain meds. um, but yeah, so we check on mom. And another thing we do, we always answer any questions that you may have. Most of us really, really love our jobs, and this is why we do it. So, no questions dumb. We're really there to help you and be there for you. So, even if this isn't your first baby, every baby's so different.
Oh, that's the
And you'll
truth.
have different questions. Yeah, you'll have different questions with different babies. It's fine. We get it. We're here for you. And then another thing we'll do is give you important instructions on when to call us for help or go to the emergency room. And those are really important because you probably heard them when you left the hospital, but who knows if you remember them. And even the first appointment after, you probably won't remember them then either, and that's okay. We're happy
Right.
to repeat everything a million times, but normally what I say is fever always, like we always talk about. If your baby has a fever, you have to go to the emergency room. You don't have to
Absolutely.
constantly checking it. If they feel super hot, aren't acting like themselves, check it and see what it is. But I've never checked JJ's temperature, but so you don't have to constantly be checking it. Breathing, If babies do really weird things breathing, they'll like breathe super fast and then super slow and then hold their breath.
They do. Yeah.
They like to freak you out. But, if for a good extended period of time, 15 minutes, your baby's really working hard to breathe, they look like they're, not calm and not like their normal breathing, reach out to your pediatrician. Take a video of it if you can and chat with your pediatrician. And then feeds too, if your baby just stops eating, won't eat at all, misses 2 feeds, 6 hours, hasn't eaten anything, definitely reach out to your pediatrician. And I rotated in medical school with a pediatrician who said this to all of his patients. And I thought it was so good that, anything that is worrying you so much that it's keeping you up at night, you're worrying about this, let me know. Just ask. That's why we're here. We're happy to answer any questions and if you need anything.
So Rachel, this is really great. I can definitely see why it's really important for the pediatrician to see the baby so soon after delivery. So you've convinced me now. When is the next time that you would see them after that first appointment? When would be the next time you would bring them back?
Yes. Well, so we might see you for a weight check. So like we talked about, if baby's percentage is down and they're not gaining weight, we usually see for weight checks until baby is gaining weight. Once they're gaining weight after delivery, we'll see you for a 2-week of life appointment. So at 2 weeks of life, we want to see the baby's weight back to their birth weight or more. So we'll see you for that 2-week of life appointment. And then 1 month of life, most of us do a 1 month of life appointment. And then 2, 4, and 6 months of life. And then after that, 9 months, 12 months, so on, so on. But everyone always asks me this, the first appointment where baby will get vaccines is the 2-month appointment. We see you at, right after delivery. We see you at 2 weeks. We see you at 1 month. Those do not have vaccines. It's just that 2-month of life appointment.
Great.
But we'll talk about all that in another episode.
Right. So you mentioned that what happens at the first outpatient appointment after delivery, but it seemed like this was for healthy newborns. What about a baby that was in the NICU that's being discharged from the ICU? That probably is different, right?
Yes. So if your baby's coming out of the NICU, they might be very complex with a lot of needs. Or, they might be the same as a healthy baby with only regular newborn care needed.
Right.
If your baby has a lot of needs, bottom line is, if your baby has a lot, JJ's being fussy. He's like,
I see that. He wants some attention, mother.
He does. I know. He's trying. He's like half falling asleep, half not falling asleep. But if your baby has a lot of needs, your pediatrician is going to be home base for your questions and concerns. They're going to help you with feeds. If your baby needs more calories than regular formula provides, your pediatrician can help with this and make sure your baby's getting enough calories during the day. Some babies are going to have NG tubes, the tube that goes into their nose down into their tummy for feeds. And some will have G tubes where they had a surgery to have a tube placed on the outside of their abdomen that goes to their tummy. Your pediatrician can help you with all of the questions and concerns about that. Oxygen, if your baby comes home on oxygen, your pediatrician will help with the supplies, getting you the supplies you need, medications, breathing treatments, all that good stuff. Will also help with your weaning process to get the baby off of oxygen and help you through that. Here in Colorado, we get a lot of infants who come home on oxygen due to the elevation.
Oh, right.
I have never seen so many babies coming home on oxygen. So I've really learned really well how to help parents wean their babies off of oxygen. But usually what we do here is an overnight pulse ox test where the supply company will give you a pulse ox to put on the baby's foot, and you'll leave that on overnight without the oxygen on, and it will kind of record baby's oxygen saturations, and then we'll look at it and tell you, your baby did well. They can, you can take the oxygen off, or they didn't do so great off of oxygen. We need to keep the baby on there. So yeah, feeds, oxygen. We're really good at helping you keep track of everything too. Oh, JJ's so cranky. We're just good at helping you keep track of everything. Usually if you come out of the NICU, you have a lot of baby appointments with
Right.
subspecialists, medications,
Right.
therapies, and we're kind of like, especially at our clinic, we really want to be your home base and ask, so any questions that you have, ask. We want to be able to answer them for you. If a subspecialist said something you don't understand or is ordering a test you don't understand, we want to be there to help you, understand those type of things. We want to be your medical home.
Aw. That's awesome. That's really perfect. It sounds like you really love your job. Yay.
I do. I really love the relationships I get to build with my patients and their families. I can, truly can be there for them for the best and worst times of their life, and see them through it all. And it's the best when parents bring, they're like, I'm gonna cry, their most prized
Aw.
possession to see me. And I get to tell them, you have the most beautiful baby, or your baby's getting so big. And it's just the best thing to see their faces light up. It's just,
Yeah.
anyways, it's the best.
Aw.
But yeah, so that's all about the first newborn appointment.
Yeah, that's great. It's not so bad. So yeah, just take your baby in.
Yeah, it's really not bad. It's fun.
Right. So I guess that's all we have for today. And it sounds like JJ wants some attention from his mother. So maybe we should let you get back to that. So as always, thank you to everyone who listens to our podcast. Please like and subscribe to our podcast if you don't already. And if you love what you're hearing from us, please feel free to leave us a 5-star review and comment or message us with any